abduction, move your leg in. That's adduction. I'm going to have you cross your leg right here. And that is external rotation. And I'm going to have you put your leg in, knee to knee. That's internal rotation. Good. Next thing I'm going to do is we're going to check your knee. I'm going to have you raise your leg. Now, extend your knee. Flex your knee. Good. Now do it with resistance. Good. And lay your leg down. The next thing we're going to look at is down here. I'm going to have you put your feet up towards your nose. That is plantar extension. And down towards me, that's dorsiflexion. And then I'm going to have you turn your ankle in. That's inversion. Out is eversion. And I'm going to have you rotate your ankle. Good. Now I'm going to have you stand up. I'm going to have you put your leg out. And that's hyperextension of the hip. Next thing we're going to do is look at the neck. So we're going to have you flex, extend, and hyperextend. Yes, and then I'm going to have you lateral bend and rotate. Good, now we're going to do that with resistance. Forward, backward, side, side, and rotate. Good. Next thing we're going to do is our shoulders. We're going to extend, we're going to flex, then we're going to extend, we're going to hyperextend. We are going to abduct, adduct. We're going to have you externally rotate and internally rotate. Good. Now put your arms down and I'm going to have you try to move forward with resistance, back with resistance, out with resistance, and in with resistance. Good. The next thing we're going to do is the elbow. So I'm going to have you flex and extend. Good. And then I'm going to have you supinate and pronate. Good. Next we're going to check the wrists. So we're going to do, this is extend, this is flex, this is hyperextend. This is ulnar and radial. Good. And then I'm going to have you try to flex and extend. Good. This is our fingers. This is extension, flexion, hyperextension. Good. And abduction, adduction. I want you to try to pull apart. Then I want you to try to squeeze. Good. And then I want you to take your fingers and try to raise them. No, flex them, extend them. Good. And then I want you to squeeze my hands. And grip is strong bilaterally. The next thing we're going to do is our back. So you're going to touch your toes, and that's flexion, and I'm going to look for scoliosis, which there's none present. I'm going to have you stand up, which is extension, bend backwards, which is hyperextension, laterally bend, and rotate. Good. The next thing I'm going to do is have you just kind of walk over there. Good, and then heel to toe. Good, and then I'm going to check all your joints out. And they're smooth, and there's no warmth, there's no pain, there's no redness, your range of motion is good, there's no lack of it, and everything is symmetrical. Great, the next thing I'm going to have you do is I want you to close your eyes, and I'm just going to good, that's a negative Rosenbaum test. I want you to do this as fast as you can. Good, I want you to test your nose to your eyes, very good, now close your eyes. Good. Great, now I'm going to have you sit down. And I want you to cross your legs like a lady, cross your legs again. And this tests the hamstrings and the quads, everything in your butt and your legs. Okay, the next thing we're going to do is we are going to do the sensation test. So I want you to close your eyes, and I want you to tell me if this is sharp or soft.
Sharp. Soft.
Good. The next thing we're going to do is the vibration test. So I want you to tell me if you where you feel it and when you feel it stop. Close your eyes.
My knee.
Good. Tell me when it stops.
Stop.
Okay.
My foot. Stop. My wrist. Stop.
Good. Good job. The next thing that we're going to do is called stereogenesis. So I want you to close your eyes, and I want you to give me your hand, and I want you to tell me what that is.
Point.
Good. Next thing we're going to do is graphioesthesia, and I'm going to draw something in your hand. I want you to tell me what it is.
5.
Okay, good. Next thing we're gonna do is we are gonna do our reflexes. So we're gonna test our triceps. Good. And our bicep. Good. And the radial ulna. Good. The patellar. Go ahead and sit back a little bit more so I can manage your patellar. Good. That's like a 2+. Now go ahead and turn around and we're going to do the ankle jerk. Good. Go ahead and sit down. So we have tested all the cranial nerves. Number 1 was olfactory, 2 is vision, 3, 4, and 6 were ocular motor, trochlear, and abducens. 5 was the facial nerve, the trigeminal. 7 is the facial gymnastics. 8 is acoustic hearing. 9 and 10 have to do with swallow and gag. And 11 is the shoulder strength, and 12 is the hypoglossal, which is movement of the tongue. And we've done a complete head-to-toe assessment on you, and I want to thank you for allowing me to do that. Okay, we're done.